Based on Patrick's collected data, there are numerous factors which may have contributed quite significantly to his respiratory symptoms. The initial factor that may have contributed to Patrick's respiratory symptoms is his history of smoking, despite quitting in the last 20 years. The damage sustained to the cilia in the respiratory airways would be already evident. The damaged cells formed through the continued use of tobacco cannot perform their purpose, therefore leading to a build-up of mucus and consequently the smoker's cough. With this being said, it can therefore be concluded that Patrick's respiratory symptoms, coughing and increased tiredness, may be due to foreign particles trapped in the airways from the prolonged smoking habit. Patrick's dyspnea is also an evident respiratory symptom. Dyspnea, also known as shortness of breath, is a major respiratory symptom present in COPD. Due to Patrick's smoking history and consequently COPD, he is experiencing airflow obstructions, inflammation, and reduced lung elastic recoil. This leads to incomplete air expelling, hence dyspnea. Most cases of dyspnea result from asthma, heart failure, and myocardial ischemia. From advanced research, it was determined that while myocardial ischemia is characterized by a decrease in blood supply to the heart tissue, myocardial infarction is the endpoint of the ischemia, resulting in the death of heart tissues due to the absence of blood. Myocardial infarction is a primary symptom of an increased heart rate, yet correlates with the respiratory system. The final respiratory symptom to talk about is peripheral edema. As research has confirmed, lower extremity edema in a patient with COPD is usually a sign of pulmonary hypertension and right-sided heart failure. COPD makes the heart work harder, especially in the right side, which pumps blood into the lungs. Due to the already poor gas exchange in the COPD patients, there are decreased amounts of oxygen in the blood, causing blood vessels to constrict. Hence, capillaries surrounding the alveoli are destroyed in the disease process. As a result, the right ventricle becomes enlarged, the walls of the heart thickens, and the chamber eventually loses its ability to contract efficiently. There are many factors that may have contributed to Patrick's tachycardia, including high blood pressure, heart failure, COPD, hyponatremia, obesity, and previous myocardial infarction to the left coronary artery. One of the main factors which has contributed to his high heart rate of 155 beats per minute, normal for a 70 to 80-year-old being 60 to 100, is fluid overload, as evidenced by his peripheral edema. Peripheral edema is fluid retention in the extremities. This is evidenced by his symptoms of reduced physical mobility and swelling from the knee down. Congestive heart failure, or Patrick has been diagnosed with, is a significant cause of peripheral edema, as it indicates a lack of circulation through the body due to fluid overload. This is because the heart is too overworked to pump blood around the body properly, so the blood gathers around the front of the heart. It is under extra pressure to work harder, therefore increasing the heart rate. This results in increased venous blood pressure, forcing even more fluid to seep out into the surrounding tissues, further exacerbating the pulmonary edema and pressure on the heart. Congestive heart failure can also cause pulmonary edema because of the left side of the heart is unable to pump an adequate amount of blood returning from the lungs. The primary sign of this, shortness of breath, dyspnea, and coughing, to which Patrick had previously been diagnosed with. In Patrick's case study, he has been previously diagnosed with both chronic obstructive pulmonary disease, COPD, and left-sided heart failure. COPD can be broken down into two separate conditions that can aid in the determination of Patrick's cause of COPD, and in most cases, an individual will demonstrate a combination of dual diseases. Firstly, chronic bronchitis is a persistent infection and inflammation of the larger airways of the lungs, which ultimately leads to persistent coughing and difficulty breathing. Secondly, emphysema is a lung condition which causes a shortness of breath, primarily due to the damage of the alveoli sacs predominant in the lungs and highly utilized in the body's gas exchange. Without the full ability of these air sacs, the weakened and ruptured air sacs are unable to efficiently move oxygen from the air to the blood. With these two conditions in mind, it can therefore be concluded that the primary cause of Patrick's COPD is his continued habit of smoking. Despite quitting 20 years ago, the damage has already been caused. The other primary condition Patrick was diagnosed with is left-sided heart failure, which has been caused by a significant lack of oxygen-rich blood being circulated around the body. As a result of this, the blood backs up into the lungs, hence causing a shortness of breath and a build-up of fluid. With this in mind, it is important to understand whether or not these conditions are relevant to each other or if one condition may actually be the cause of the other. In this case, it is believed that his left-sided heart failure may be primarily caused by his COPD. Due to Patrick's continued use of tobacco, the alveolar walls in the lungs have been permanently damaged, therefore leading to significant decrease in the amount of oxygen-rich blood circulating the body. As previously stated, left-sided heart failure is primarily caused when the left side of the heart is unable to pump blood efficiently due to the lack of oxygen. Without emphysema, Patrick's heart would be able to pump the adequate amount of blood into the circulation system, hence preventing Patrick's dyspnea and exhaustion. Yes, Patrick is at risk of developing right-sided heart failure for multiple reasons. Left-sided heart failure. Due to decreased cardiac output from the left ventricle as a result of left-sided heart failure, Patrick's kidneys will detect this insufficient blood flow and adaptive mechanisms such as the renin-angiotensin-aldosterone system is activated. The outcome of this activation of the RAS is an increase in blood volume and blood pressure due to retention of sodium and therefore water. This leads to peripheral edema. Due to the accumulation of blood in the pulmonary circuit, the right ventricle needs to work harder, eventually leading to right-sided heart failure due to stress. This results in loss of pumping power, which can also lead to a backload of blood causing swelling or congestion in legs, which it appears Patrick has. COPD is another risk factor of right-sided heart failure. The heart and lungs are intimately connected as they work together to remove carbon dioxide and deliver oxygen to the body tissues. Therefore, the health of one system can significantly affect the health of the other system. Due to Patrick's COPD, he has low oxygen levels in his alveoli. This leads to pulmonary hypertension due to the increased blood pressure inside the arteries as a result from abnormally low oxygen levels in his vessels. This increased pressure on the right ventricle of the heart can cause strain, therefore right-sided heart failure can occur. Patrick's BMI and blood test results indicate that he has cardiovascular risk factors. Results including high LDL, low HDL, high triglycerides, and low hemoglobin. Lifestyle factors such as smoking, diet, and lack of exercise due to his COPD are contributing factors to these test results. The test results also indicate that he has diabetes mellitus 2, which means he is at risk of getting diabetic neuropathy. As a result of this, he may not feel the typical pain, such as chest pain, associated with a heart attack. Therefore, if Patrick was to have a silent MI, he is less likely to present to the hospital, which could have a worse outcome. Also, diabetic neuropathy can result in reduced sensation in the lower limbs. If Patrick was to experience trauma to the area, a cut or an ulcer, it will more likely go unnoticed, which may lead to cellulitis and subsequent complications. An additional blood test that would likely appear abnormal for Patrick is the glycated hemoglobin blood test. Glycated hemoglobin is formed by a chemical reaction between glucose and hemoglobin, where the rate of glycosylation depends on blood glucose. The glycated hemoglobin blood test reflects an average of how much sugar has been in the blood over the past 3 months, rather than measuring daily ups and downs of blood glucose. Therefore, this blood test can help diagnose diabetes. Patrick's fasting blood glucose reading suggests he has diabetes. However, this test will give a more accurate indication. It is expected that Patrick's HbA1c reading will be elevated, 7% or above, due to multiple factors which suggest he has diabetes, including high blood glucose reading, high triglycerides results, and his obesity. There are also other recommended blood tests for Patrick that are written on the slide.